The Duke University Cancer Genomics Holy Grail scandal is one of the most significant cases of research misconduct in modern medical research. This video is presented as a dual format, which includes AI narration and references. For more information on the event, please follow the references at the end of the video. Thank you. In 2007, Duke University publicized what was described as a major breakthrough in cancer research, a genomic method that aimed to match chemotherapy treatments to the specific DNA characteristics of a patient's tumor. The research was led by Dr. Anil Potti and was promoted as a potential holy grail of personalized cancer medicine. Duke highlighted the work in promotional materials and television advertisements, emphasizing the promise that genomics could transform cancer treatment. Encouraged by these claims, more than 100 patients, many with advanced or terminal cancers, enrolled in clinical trials testing the approach. As you could imagine, the research generated significant excitement because it suggested doctors could predict which chemotherapy drugs would be most effective for individual patients. However, the work later became highly controversial when scientists identified serious problems with the underlying data and analyses, ultimately leading to the suspension of the trials and investigations into the research. The Duke Anil Potti scandal was not simply a case of honest scientific error. Investigations later concluded that some of the underlying research contained false and manipulated data, which made the genomic tests appear far more accurate than they actually were. Some of the key findings included: 1. Patient outcomes were altered in datasets to improve the apparent accuracy of drug response predictions. 2. False clinical results were reported in grant applications. 3. Images and records were misrepresented. CT scans presented were not actually from that study, concluding that Potti altered datasets and disregarded accepted scientific methodology, resulting in false claims about genomic predictors that supposedly identified which chemotherapy drugs would work for individual patients. The gap was first spotted by outside biostatisticians Keith Baggerly and Kevin Coombs, who struggled to reproduce the published results and uncovered inconsistencies in the data analysis. Their critiques eventually led to broader scrutiny, suspension of the clinical trials, and multiple paper retractions. In 2015, the U.S. Office of Research Integrity formally found that Potti had engaged in research misconduct. By that point, the clinical trials had been halted, Duke had retracted the underlying research, and numerous publications connected to the work had been withdrawn or corrected. The tragedy of this case was that more than 100 cancer patients had enrolled in trials based on promises of personalized genomic treatment, believing the test could identify the most effective chemotherapy for their cancers. The most important lesson from the Duke case is that groundbreaking medical claims should be independently verified before they influence patient care. Transparency, replication, rigorous oversight, and a scientific culture that encourages critical review are essential to protecting patients and maintaining public trust in research.
If interested in the references used to create this video, please pause to capture this information. This video was a collaboration between Laura and Katrina as part of a pre-conference PI bootcamp resource, developed in partnership with Socra. If there are any questions, comments, or concerns, please contact Socra per their website contact.